The so-called kissing bug disease may be becoming endemic in the U.S. Human cases of the potentially deadly illness that they spread, the bugs do, have been reported in several states. A closer look at Chagas disease in Health Watch.
A report is raising awareness about the spread of the potentially deadly Chagas disease in the U.S.
Kissing bugs are blood-sucking insects, just like mosquitoes and ticks, and they're responsible for spreading a parasite that can cause Chagas disease.
Dr. Sarah Hamer is a veterinary epidemiologist at Texas A&M University.
Chagas disease is certainly not new in the United States. We've had the kissing bug insect vectors, the Chagas parasite, infected wildlife, infected dogs, infected humans have all been around interacting for a long time.
The disease is already endemic to 21 countries and the Americas. Locally acquired human cases have been reported in 8 states.
I think it's important to emphasize that the risk is very low. This is exceedingly rare. So for most people, this is not something you should be worried about. The people who are at highest risk live in substandard housing, particularly in rural areas and communities with limited access to pest control or screening. Hunters, campers, and other people who come into close contact with wildlife.
CBS News medical contributor Dr. Celine Gounder says diagnosing Chagas can be tricky. A person may have no symptoms when first infected or mild symptoms like fever, fatigue, and body aches.
Many people don't know that they have Chagas disease until the chronic phase, which can be many years later. About 20 to 30% of infected people can develop serious problems years later, which include an enlarged heart, which can cause heart failure or an abnormal heart rhythm. They can also develop an enlarged esophagus or colon, which may interfere with gastrointestinal functioning.
There are anti-parasitic treatments for Chagas, which work best when started early.
Now, kind of like Lyme disease, doctors hope the CDC will encourage state and local health departments to do surveillance and educate doctors so that this is on their radar while seeing patients. For a closer look, go to the feature section of our website, 2news.com, and click on the Health Watch icon.